Peter Schiff Show.
Joining our program now is Keith Knapp, and Keith married his high school sweetheart, Michaela Knapp. They're both age 25, but unfortunately, Michaela has been diagnosed with stage 4 kidney cancer, and the only hope of recovery would be an experimental drug, which is available and is currently in clinical testing. But unfortunately, Michaela, for various medical reasons, was not able to qualify to be part of the testing. Yet the drug might help her anyway. The drug exists. It's there. It might save her life. You would think she could just use it. But unfortunately, based on government regulations, it's not that easy. Keith, welcome to the Peter Schiff Show.
Thanks for having me on the show, Peter.
Hey, thanks for coming on, and my greatest sympathies to you and your wife. It's a terrible tragedy, especially somebody as young as your wife to get a disease like this. This is an extremely rare situation, right? I mean, how many people would get stage 4 kidney cancer?
Yeah, well, she actually has a very rare subtype of kidney cancer, too, that's growing in prevalence among young women. And when we look in the medical literature, there's fewer than 200 reported cases. So it's just a very rare situation overall. And we're just, it's a dire situation, and we don't have a lot of time because we've run out of FDA-approved options to treat her cancer. So we just know she's laying in bed with the cancer growing inside of her uninhibited.
How long?
That's just fueling us to really engage in this fight on a deeper level.
How long ago was she diagnosed?
October 2013.
Yeah, and were there any FDA approved treatments that you tried that just were ineffective, or?
Yeah, so I mean, a decade ago, she would have been sent home, and we would have been in hospice care. There wasn't a lot to treat this kidney cancer with. Within the last 10 years, there's a whole class of drugs now that none of them can cure you. It's mainly a managed descent. But this new drug, the anti-PD-1 immunotherapy we're trying to get access to, there's actually people who have had the cancer disappear and not come back since they started the clinical trials last year. It's a really promising frontier.
And they can't do, like, a transplant wouldn't do anything, or?
No, we've actually had dozens of people through our Facebook group offer to donate their kidneys, but that won't help in this situation.
Oh, so a normal kidney would just somehow it would also end up with the cancer if you put it.
Yeah,
if
I mean
you
the problem at this point is that the cancer is systemic. It's in her bones, it's in her brain, it's in her lungs, it's everywhere. So the kidney is actually still functioning fine, even the kidney that's got the tumor growing into it, because the kidney, no matter how every little part that makes up the whole kidney functions on its own. So like she's still, her body still functions normally. That's not the issue.
But when she was first diagnosed, when they had it already spread, or at the time was it contained to the kidney?
When she was first diagnosed, it had already spread. They said with this subtype, it tends to happen in young people, and they tend not to, their body still functions fine, so they tend not to figure out that they have cancer until it's spread pretty far. So right away, within the first week of getting her diagnosis, we were already in, whole brain radiation and things like that. So it was a pretty intense, start right from October 7th when we found out. And the past 6 months have just been a whirlwind. And only the past couple of months have we found out about this drug that has proven very effective in previous clinical trials with kidney cancer. And we've tried to get into all those clinical trials that are listed on the government's clinical trials website, and every single one is rejecting us. We keep checking that site every day, but we just think that, patients like Michaela are completely neglected in the current system.
But you're saying at this point it's not just kidney cancer, because now that it's spread, it's cancer of the brain, or it's cancer in various different organs. But
in terms of its genetics, it's all based in this. It's called translocation renal cell carcinoma, and they have to attack it the same way throughout the body.
Oh, okay, I got you. So tell me about this new experimental drug, and how is this different from the drugs that are already on the market?
Yeah, so basically the drugs that are on the market right now, which most of them were FDA approved within the last 10 years, they disrupt processes that create new cancer cells, which is great for trying to stop the spread of the cancer, but it's not good for getting rid of the cancer that's already there, the tumors that are already throughout her body. This new drug actually, they found that the tumors kind of cloak themselves in some kind of substance. It has a genetic component that's called PD-1, and what this medicine does is it goes in and it removes that cloak, and it allows your body's immune system to attack the tumors like it's supposed to. I mean, you and I both right now, we have tumors growing inside of us that our immune system's going to, put to rest. And just for some reason, Michaela's didn't take care of this initial tumor and it spread. So this takes away that tumor's cloak, lets the body's immune system attack the tumors itself.
Do you know how long the treatment would take to be effective? I mean, if she were to go on this drug, I mean, how long would it take to know if it worked?
It's clear. I'm not too sure about that, but I would say that it doesn't work in everybody. From looking at the studies, it appears that 20 to 40% or so of people that they tried it on, it worked for them. But the real encouraging thing is that in the people that it did work on, these studies have only been going on for a couple of years or so. And there's people who were in the earliest studies who had their cancer disappear, and it still hasn't come back. The doctors think it's going to come back, but it still hasn't come back. So this is the first medicine that's ever been invented that could potentially cure kidney cancer. So that, for us, that small chance of that miracle happening is just a hope that we haven't been able to latch into for the past 6 months.
Where and you would think,
have been trying,
with so few people getting this particular type of cancer, they would want to see if the drug would work on your wife. But if she doesn't get this drug, what is her prognosis right now? How much longer will she live without this drug?
So I'll put it to you this way. We've tried every way we can to get in touch with these pharmaceutical companies. And our last chance is in next week. We're going to go and deliver our hundreds of thousands of petitions to them. I'm going to go do that personally. 2 of them are on the East Coast. When I go to get on that plane to leave, I'm going to have to say goodbye to Michaela in case something happens while on the way. The hospital where she's at right now has required us to put an advance directive on file. We don't have a lot of time. So
she doesn't have the luxury of waiting to see how the clinical trials, pan out. She won't live long enough to see the process to its conclusion. And so there's no valid reason. I mean, even if it turns out that the drug doesn't work, well, she's going to die anyway, right? So why can't she at least take a chance? And even if the drug harmed her in any way, it can't harm her any more than the cancer already has. So there's no medical reason why she shouldn't be able to have this drug. So why can't she get it? Why do you have to beg the pharmaceutical companies to allow her to have this drug? I mean, they invented it to save lives. Here's somebody whose life might be saved. They've got the formula, they've got the serum, whatever it is. Why can't she have it?
There's one reason, Peter. It comes down to money. It costs them about $1 billion to put this drug through, $1 billion per pharmaceutical company to put this drug through the FDA's approval process. And basically the way that works is they don't want to expose themselves to any trials, any tests of their drugs that the FDA doesn't completely require. So in the case, if some new side effect appeared or if something happened that the FDA thought that they needed to explore further, these companies would be exposing themselves to, tens of millions of dollars at least in additional testing and additional time of waiting for this to, be on the market.
So it's not that it doesn't cost them money to give your wife some of the medicine. I mean, the medicine is already there. The actual cost of providing it is probably negligible, but they're worried about the regulatory backlash. They're worried about.
We've heard from their scientists who actually work on the development of this drug for these companies. They've written me emails refuting the points that these pharmaceutical companies are making about there not being enough drug on hand for them to give to us, about them not having a profile of what the potential side effects could be, about them not being able to give her a proper dosing schedule. We've heard from scientists who are internal to these organizations that these things are worked out. So to us, that just, we want to keep this campaign positive, but the longer that this campaign goes on, it's only been about 2 weeks now, but we don't have a lot of time. It's becoming abundantly clear to us that we can't appeal to these folks in the way that we would appeal to, other humans. So we're really trying to look into other ways to.
I can tell you, though, that your real problem is not the pharmaceutical companies. It's the government. It's the FDA. If the FDA did not require all this expensive testing, then you would have that drug. The pharmaceutical companies invented it. They created it. They want to cure people, and they would like to be able to proceed without FDA approval. And I wished we didn't have an FDA. I wish the FDA didn't exist, and I would like the free market to be able to bring to market as many drugs as they can and let patients and doctors evaluate their effectiveness without government interference. But unfortunately, that's not what happens. We have this bureaucracy, and it does cost hundreds of millions of dollars to develop a drug that, absent the FDA, could be developed for a fraction of that cost. And I think all of their objections to sharing this drug have to do with the regulatory costs and burdens that they're exposed to. I'm sure that they would love to be able to help, but it's the government that is preventing them from doing so.
I definitely agree with you that there's a clear need for some policy change in this area. I mean, we're not the only people to have one of these petitions for access to a drug. Even in the past month, there's been stories on CNN and all around the internet about people, pushing for access to different drugs. So I definitely agree that those are symptoms of some kind of a flaw in the current system, and we do need policy-based solutions to fix this. I guess for me, though, I'm focused on my wife, and I don't have time to sit around and wait.
Well, and I hear you. And, the government needs to issue some kind of waiver to these companies. They do allow you to try an experimental drug if, the prognosis is that your wife won't survive without it. So they don't have to worry about the drug harming her because she's already been harmed, by the cancer. But they should come out and they should issue a waiver. Why don't you petition maybe the government or the FDA could say, look, we're not going to consider anything that happens because we don't know if maybe it won't be used right, maybe it won't be in the right environment. We're not going to look. Whatever happens to your wife, good or bad, it's not going to factor into the decision as to whether or not the drug is approved, and we are not going to require any additional testing or additional studies as a result of what may or may not happen with your wife. I mean, the FDA could say something like that, and then the company would be able to provide that medicine without fearing the repercussions.
Yeah, we're actually working through some of our representatives to try and work out something like that with the FDA. But the problem is that these governments, they just move so slow. To get the FDA to help us with this, it would take probably weeks, if not months. And we just, we don't really have time to funnel all our efforts into that angle. So we're definitely covering that angle, but I wouldn't be too hopeful about, the FDA suddenly moving quickly and coming to our aid. They do have a program for compassionate use for drugs that they designate as breakthrough drugs, which means that they're basically much more promising than the current treatments for what you have. And that's what they've designated these drugs as. But basically, the program is in place, but there's really no incentive for the pharmaceutical companies to actually agree to provide the drug under that program. In fact, there's, like I said before, they're just exposing them to risk of the FDA forcing them to do further trials. And we've told both the FDA and the pharmaceutical companies that we're willing to sign away any right to sue. I mean, I'm saying that I would be willing to sign away any right to talk about what happens with Michaela's case. Hell, I'd even be willing to sign away my right to ever talk about Michaela's existence, going forward, if we could just try out this drug. I mean, that's all we want right now. We have a doctor willing to give it to us. We have people willing to help us through the FDA in under a week. All we need is a pharmaceutical company, either Bristol Myers Squibb, Merck, or Genentech, to provide us with their version of this drug.
Yeah, and the only reason that they can't is because the government that you pay taxes to, the government that is supposedly there to defend your rights to life, is not doing that. They are basically providing a roadblock, preventing your wife from sustaining her life. I mean, it shouldn't be this way in a free society. You're an adult. Your wife's an adult. You can make a decision. It's not up to the government to decide for you and your wife what drugs you consume. You can weigh the risks, you can weigh the benefits, and make a decision without the government having to force these companies to spend hundreds of millions of dollars to satisfy some kind of a bureaucrat that the drug is effective or that the drug works. Let the individuals decide, let the doctors decide, and the politicians should not have a role in this process. But we got a quick break. When we come back, I want to talk about what you're doing, your petitions. If there's anything that my audience can do to add their voices to yours to make it easier for you, to prevail in this humanitarian plea for these companies to provide this life-saving drug to your wife. So we got a quick break, and we will be right back.
About the waves will flow.
The Peter Schiff Show.
9 out of 10 historians agree. If Thomas Jefferson and Thomas Paine were alive today, both would be Schiff Radio Premium members.
Somewhere up there, Thomas Jefferson is looking down with great pride.
Schiff Radio continues right now.
We are talking with Keith Knapp, whose wife, Michaela, is dying of incurable kidney cancer. There is one potential drug that could save her life, but she is not. They're not able to avail themselves of that because the pharmaceutical companies are fearful of the FDA ramifications should something go wrong with this. Keith, it's first of all, it's terrible that in addition to having to deal with the cancer, that you also have to deal with this, that you have to deal with the added heartache of government. But, a lot of the executives at these pharmaceutical companies, and they're major, publicly traded companies, and they're not heartless people. I'm sure it pains them that they cannot provide this medication. But maybe what they're thinking and what their concern is that if they allow your wife to use it and something does go wrong and it delays the approval process by a year or two or more, maybe they're thinking that a lot more people will die because of the delay of getting the drug to the market. So maybe they're thinking about that aspect of it.
Yeah, I mean, that makes sense to me. But I just think that if we're looking at this in terms of how it helps we, the people, the Americans, the people of the world who are going to be using this drug, why would we not want it to be tested with Michaela? How does it benefit us for us to be in the dark about how it works on people with this rare subtype of kidney cancer?
It doesn't benefit us. It doesn't benefit us. This is government. This is how government works. And I'm glad that, at least in this tragedy, you get to do whatever you can to shine a light on how evil and how bad government is. I mean, they act like they care about us, and the FDA is there to make our lives better when that's not why it's there. There are lots of drugs that would already be on the market. I mean, maybe this drug would have been approved years ago. Maybe there would have been more drugs that were available to your wife. Maybe she would already be cured if it wasn't for the FDA. Who knows how many cures were never brought to market, were never developed because the government made it too expensive to try. If it wasn't so expensive, we would have more experimentation. More people would be able to try these experimental drugs. Some wouldn't work, but some would. And we would know. We would know the ones that worked. But of course, because of government, all that progress is delayed dramatically. But I wanted to know, so what can my listeners do to help you? I know you said you're trying to get signatures or...
Yeah, so they can sign our petition at change.org/SaveMyWife. And from there, we're really hoping that that's a springboard for people to get involved. We've had people from all of these companies get involved with our cause. We've had people with good contacts for us in the FDA or elsewhere get involved. So really, people have brought a lot of different skills to the table, and having our community on there has been very useful. And today we'll be passing 350,000 people in just 2 weeks. So we want to see it keep continuing to grow.
350,000 in 2 weeks. How have you gotten so many signatures? What other platforms have you been able to speak on to get that kind of outpouring?
Yeah, so within the first week, we got coverage on Good Morning America and a lot of Forbes blogs and things like that. This week will be Fox News sent out a reporter for us to be like a little segment on some of their news shows throughout the week. So we're hoping that will continue to drive some interest in the story. And really right now we're just getting the background story out. And as we move forward, we're going to start bringing in our community a little bit more into our strategy. But right now we're just trying to grow.
Yeah, well, we're not as big as those networks, but hopefully you'll get a few more signatures added to your 350,000. But Keith, I really appreciate your coming on the show. And look, my very, very best to your wife. I hope she gets this drug, and I hope for everybody that it works, because we really need to cure these cancers, and it would do a lot of good to at least give your wife a chance. Thanks for coming on. You've been listening to the Peter Schiff Show here at SchiffRadio.com, the gold standard in